I'm Dr. Barry Eppley, plastic surgeon of Indianapolis, and I'd like to talk to you for a few minutes about eyelid surgery. Eyelid surgery, otherwise known to us in plastic surgery as blepharoplasty, is where you actually tuck up and remove excess skin and fat from the eyelids, refreshing one's overall facial appearance. Eyelid surgery can be one of the most dramatic procedures in terms of creating a very significant change in your appearance. All of us have had the unfortunate events of coming into work in the morning, walking down the hallway, and the very first thing someone says to you is, "You look tired. Have you been up all night? Did you have a late night last night?" We all have been faced with that frustrating comment, and what that represents is someone's impression of how we look, which is based exclusively on the appearance of our eyes. As we age, going from the 30s into the 40s and into the 50s, we develop excess skin and fat around the eyelids, creating fullness, heaviness, and often some swelling, particularly in the lower eyelids, which could take hours or all day to go away. This creates an overall tired or aged appearance. Eyelid surgery dramatically changes that. Eyelid surgery removes skin and usually some strips of muscle from the upper and lower eyelids, and particularly a fair amount of fat often from the lower eyelid. This helps crispen up and freshen up the overall appearance around the eyes. Eyelid surgery is really relatively simple. It is an outpatient procedure. It is not something that gives you much discomfort. However, there is definitely a social recovery to it. There is going to be some swelling and some bruising, and this is certainly going to be visible to many around you. How long you will have swelling and bruising is going to depend upon what type of eyelid procedure was done and how much skin and fat was removed. On average, it takes most people at least 7 to 10 days to sort of look non-surgical and non-operated on. Some people are going to take a little bit longer to have complete removal and clearance of any bruising that has occurred. So you definitely need to factor that into your schedule in terms of recovery. If you don't happen to care what you look like and that people know that you've had surgery, then you may be back to work within 4, 5, 6 days. If you do care, you're likely going to take up to 2 weeks before you'll be back into the social circuit to be seen again without having people know that you've obviously have had surgery. Be aware that and be informed that eyelid surgery, like all surgery, can either be done in a minor fashion or a major fashion. In the younger patient in the 30s and 40s, often only a very small amount of skin needs to be removed, and the lower eyelids could be done with a little pinch of skin, some removal of fat, and a little chemical peel. As one gets older and has a bigger skin and fat issue around the eyelids, then the procedure is going to be a little more extensive and the recovery is going to be longer. So it's simply a function of matching the operation to the degree of eyelid problem, and that is very much related to the age of the patient. Anytime we talk about eyelid surgery, we never want to factor out one's brows. The eyebrows and their position of the forehead can sit at or below the bone level, what we call the supraorbital ridge, and this may well contribute to an overall aged appearance of the eyelid area. So in many patients we want to consider the possibility of brow lift surgery. That is going to be the subject of a different video talk, but brow lid surgery is often done in combination with upper and lower eyes, particularly in the older patient who has a more extensive problem. These are some thoughts for you to consider on eyelid or blepharoplasty surgery. I wish you the best of luck in your eyelid surgery efforts. I'm Dr. Barry Eppley, plastic surgeon of Indianapolis.